we worked together to develop that document. These documents have been widely disseminated. All school owners, principals, proprietors, they know about this protocol, and it is their duty to ensure that there is full compliance of this protocol. Now, even before the opening of the schools, the Ministry of Education came back to provide an assurance that all the schools are ready to open, which means if they say they are ready, which means that they have the protocols and have made all the necessary arrangement to ensure that these protocols will be duly followed by both the administration and also complied by the students.
Okay, let's look at unity schools now. There were indications by the PTF that they will not be open on the 18th of this month, like other schools have. Can you update Nigerians in this regard? Is there any development?
I must say that should go to Ministry of Education. As I am aware, what we know is that the Ministry of Education actually wanted the school reopening delayed because of the current situation. However, they had consultation with their counterparts, which are the commissioners of education in all the 36 states. And after their consultation, they came back to the conclusion that they want the schools to be reopened. That they are ready, they have seen the protocol, and they have made all the necessary adjustment to ensure that there is safety for the staff and for the students of the schools.
All right, now one of the major fears of the second wave of the disease is the lack of compliance by some Nigerians to the safety protocols. What has been done in this area, bearing in mind that an asymptomatic child or person can affect other family members at home?
Yeah, exactly. So this is really the danger of COVID-19. If it is a frank disease that people express symptoms, they will be sick and they will stay at home, or once they start having symptoms, people will get away from them. But 80% of the patients do not have symptoms, and they spread the infection. So, and that is why it is important that everyone takes responsibility. Whether you have symptoms or you don't have symptoms, you must take responsibility. One, to protect yourself from getting the infection, and two, in case you have the infection, you also protect others from you. So it is important that Nigerians become more self-conscious and Nigerians become more compliant to these protocols. It is not that government is trying to make things difficult or enforce these things. Let Nigerians understand that these measures that are put in place is for your own personal benefit and for the prevention of your family from getting COVID-19. So enforcement measures, yes. We are looking at it, and we are going to come out with enforcement measures that will be recommended for all the states to implement. And this is going to be serious, which means that if this enforcement come into play, that anybody who does not take protection, who does not take responsibility, you go to the market, you are not wearing face mask. Okay, so we will have a task force that will arrest such people and fine them. People will pay fine for violating this protocol. If you are an owner of a store or you are an owner of a mall and you don't have temperature checks before people without face mask to enter and contaminate the place, you will also be fined and your business will most likely be closed. So these enforcement measures are going to come into place very soon. However, what we are doing now is sensitizing Nigerians so that everyone understands what we are doing or what we are saying, and people take full responsibility.
Okay. At the starting of the pandemic last year, we noticed that there was a task force, or there is a task force here in the FCT that was going around to religious places. Now, in regard of this measure you just talked about, how do you manage religious places, considering the sensibility of Nigerians when it comes to religion? churches, mosques, and so on.
Yeah, absolutely. Let me just use this opportunity to thank the religious bodies in this country. They have cooperated very well. They gave us the maximum cooperation during this pandemic. You will recall that when we asked for churches and mosques to be closed, they cooperated and they closed the mosques and the churches. When we asked them to take measures, they cooperated. So we are still in dialogue with them. We are carrying them along, and they understand very well, because all the religious bodies, they are knowledgeable people. Okay, they understand that this pandemic is not something to joke with, and the religious injunctions also do not allow people to do acts that will put the population or the community at risk. So just by that guidance, the religious bodies understand and they have done their best. We are still engaging them, and we are going to engage them more to have a discussion about the next measures that we are going to put in place. This second wave is serious. If you recall, around June or July, April, May, June, when we had the lockdown initially, the numbers are not as much as we have now. Those numbers were a child's play. The numbers we have now are in excess of 10,000 per week. In April, May, the numbers we were reporting were just 300, 400, maybe 500, the highest number per day. Okay, but now we are reporting 10,000 and more per week. So it's really a serious one, and the mortality rate, we're also seeing that is becoming high, even though our CFR has remained largely the same, but we have seen more people dying with the second wave of the epidemic.
CFR will mean?
A case fatality. So case fatality means the number of people who died out of the number of people who had the disease.
Okay. Now, in the course of all this, a window of opportunity for surviving the pandemic came, which is the vaccine being administered in some parts of the globe. When is Nigeria likely to have its consignment?
Yes, you are right. The most important topic now in the COVID world is the vaccine issue. And as you know, there is a scramble to get vaccines. Everyone is trying to get their people immunized, because we know, based on science, that the more people you get immunized, the less the transmission in your country. And if you are able to vaccinate about 80 or 85% of your population, you are likely to have what is called herd immunity, which means that the whole population, even those who have not taken the vaccine, will now be protected against COVID-19. So as we know, the rich countries are scrambling, and they are trying to get all these vaccines from source. Nigeria is also making its own effort, and we are working with other countries like us, the middle and low income countries, to try to secure a slot for these vaccines. Right now, we hope the NPHCDA is leading that discussion. That's the National Primary Healthcare Development Agency. And we hope, from what we have been told now, is that towards the end of January or early February, Nigeria may get its first consignment of the vaccines.
Okay, by the end of 2021.
Well, exactly, that is what we have been told, and we are working towards it, and we hope that it will materialize.
So are we looking at several tests to be carried out, validation by NAFDAC and so on? How long do you think? Will this also include that period?
Okay, so the development of vaccine is not something that is done in secret. Okay, in the science world, it's something that is done openly. Each vaccine, before it becomes for public use, it has to undergo what is called the vaccine development trial, which is in about 3 or 4 phases. So, and for every phase of that development, the manufacturer will make the data available.
and it will be discussed in scientific community, and you will provide the evidence base on what you have.
Okay.
So generally, we'll say that we have been following up on the development of the vaccines since this pandemic started, or since the vaccine development started. And this started very early. We're talking about February, March 2020. And we've been following up on which vaccine is making progress and which one got dropped. Right now, we have about 6 candidate vaccines, which are very good, which are finalized, which have efficacy of between 60, to 90 or 95%. And the vaccine that is going to come into Nigeria will certainly be one of these vaccines that have undergone the phases of the vaccine trial. And when they arrive here, definitely our regulatory bodies have to look at them. We'll have information about the vaccine itself, the content, the safety, side effects, and others, and they will test the ingredients to also ensure that there are no other contaminants in them. So our regulatory agencies have to give us that assurance before we make this, we start using these vaccines. It is not going to be a long process, because I believe NIMA, which is the Institute of Medical Research, and NAFDAC, have what it takes to be able to provide this information that is required.
So, having said this, it's absolutely difficult to look away from some of the controversies that have come as a result of the vaccine, on Western conspiracy schemes to depopulate Africa and so on. I want you to have allayed the fears of Nigerians over the use of the vaccines. How safe are they?
Well, let me say that for every new thing, usually the natural human tendency is to try to reject or associate it with something negative. For these vaccines, let me assure Nigerians that this has not been done in any secret. Anyone can verify and validate what is going on. Data is available on the clinical trial. That is how many people have been given the vaccine, how many people have been given that is not the vaccine, and in the end, what proportion of the people who have been given the vaccine, developed immunity, a long-lasting immunity that, this vaccine will be said to be efficacious. Regarding conspiracy theories, well, certainly I think we have a lot to do in this area. In Nigeria, if you recall, Nigeria is one of the countries, it's one of the last countries where polio was eradicated in the world. And we had a very difficult time trying to make our people to understand that the polio vaccine did not contain contraception or something that will make people not to reproduce. It did not contain things that are toxic to the body, so that it will kill the black man and allow, some other people to live. It's education. So we have to continue and intensify our education. What is most critical is to own the process. That is, people who are in science, people who the people trust, with their health. That's what I mean, healthcare providers, scientists, people respected in the community, have to come out and say exactly what they understand by this process. And they cannot just do that without looking at the evidence that is there. So read the literature, look at the content, and look at also what the scientific community globally has come to agree on, the consensus that is there. So in that wise, our leaders, both the scientific, educational, religious leaders, and traditional leaders have a significant role to play to ensure that we dissipate very quickly any fears of stigma, discrimination, conspiracy.
The registration of this new registration, then if they cannot decentralize it and have banks do it, churches, mosques, schools do it, so that there won't be much crowd. Then let them suspend it for now. That's my opinion.
Okay,
Then
name registration.
when it comes to the schools, well, we can have a physical closure of schools, but it doesn't necessarily mean that when the schools are closed, that learning is also closed. It shouldn't be so. It shouldn't be synonymous with learning. We must have a way of getting around it. So if we want to have a physical opening of schools like we have now, they can, every stakeholder should adopt a method. It depends on the state and the school. The size of the population size, that's the problem. So if they have a population size, a multi-population size, they can now stagger. You know, every class don't have to resume on the same day of the week. They can have Monday, Tuesday, Wednesday, maybe for just classes, and then the other ones just like that, even also in the primary level. So that's the way to go about it. We don't shut down learning. God bless Nigeria. Let's not give up on this country. We'll get it right sometime someday.
Amen to that. Yes. Thank you, Ada Onugo. Hello?
Good morning. My name is Chief Fidel Onyenek, and I'm calling from Owerri in Imo State.
Well, go ahead, please.
Yeah, we need to make sure that there is equitable distribution of these vaccines when they come, so that they will be in all parts of the federation. Secondly, the federal and state governments must make adequate provision by way of providing cold chain stores where these vaccines will be stored. Let there be budgetary allocation, special one indeed, considering the need to make sure that these vaccines are properly stored. There is adequate need for us to engage the community, various community leaders and so on, through the local government health division, so that they will enlighten the people and educate them on the need to accept this vaccine. Because based on conspiracy theory, most people are very, very apprehensive. They are not sure that the vaccine will be of any help to them. We need to convince them and talk to them so that they will appreciate the efficacy of this vaccine. Above all, let us use not just the conventional media, but even traditional media, including town criers and so on, and educate the people, enlighten them the more. This is the best time for us to use our health educators at the various local government areas. Let us convince Nigerians, let them know that to take this vaccine is not a crime, but rather it will be a help for everybody. Thank you and God bless you. I'm Fidel Onyeneke.
Thank you. Thank you, sir. Hello.
Good morning.
Yes, good morning, sir.
Good morning, our guest. My name is Chief Jude Ubaja. I call from Imo State.
Yes, go ahead, please.
To begin once more by commending the federal government for the proactive measures it has been using in fighting the COVID-19 pandemic in the country, even in the fourth wave. I encourage her to do more and to specify more efforts in this second wave that is specific to medical profession by encouraging national education agencies to synergize with media houses like Radio Nigeria, traditional rulers, leaders of progress of business and others, to educate Nigerians, especially those in the rural area, to embrace the vaccines when they come, into the country, as they are safe, as the interior, together with embracing the non-pharmaceutical measures in the meantime, before the vaccine arrives, in order to get protected from this disease. The government to build more primary health care centers, testing centers, and more indigenous health attendants there, who will learn the language and other cultural barriers that eventually make the rural dwellers friendly to reduce to take these vaccines when they come, and equally employ them to actually obey the pharmaceutical preventive measures so that they can...
Thank you, Jude. Jude, you need to... Hello? Okay, I think but I think the message has been...
Hello, good morning.
Yes, good morning. Yes, good morning. Go ahead, please.
My name is Nura Ibrahim from Bongo.
Uriel Ibrahim.
Nura,
sorry. Zamfara, okay. Go ahead, please.
To my own observation concerning issue of COVID-19, the NCDC, the one was everyone want to be vaccinated. That is why they increased the number of cases in order to scare everybody in Nigeria, in the country, so-called Nigeria. The aim is to achieve something. Please, let us just wait and see what this country wants.
All right, thank you, Nura. I think you've made your point talking about conspiracies and controversies like we mentioned earlier. Okay, I think we should take the last call, then we'll come back to our guest.
Hello, good morning.
Yes, good morning.
Thank you very much. My name is Adikumala. I'm calling from Jos.
Adikumala.
Yes, Kumar from Jos.
Okay, go ahead, please.
Yes. I want to commend the doctors who have spoken well on this issue of the federal government issue on this coronavirus. But my question is that this issue of vaccination, they have said that it's not everybody that is eligible because of the immune system for the vaccination now. How are we going to get the people now? Are we going to have a test before the vaccination, or how is it going to be? And second thing is that some people do not believe on this vaccination till now. I'm calling on those kind of people that even though you do not believe on the coronavirus, you should not be coming out to be voicing it out so that you will be saving the people in your community, because coronavirus is real, and we are calling on the federal government again to give more awareness to the people at the grassroots. And the way the government is politicizing the issue, the government has to be very, very clear so that people will understand this is the danger of this disease, because people are dying on this disease. If you check in other countries, they are localizing the medicine. They are calling on the federal government also to have a collaboration on how we are going to get our own local medicine so that people will accept. People will not accept that foreign medicine like the one that we are going to localize. And we have a good medical team that they can work and bring out this medicine. And we are spending a lot amount of money. And preserving the medicine again is going to be something that is very going to be hard for Nigerians. Because some places that they do not have that cold preservation, how is it going to be? Like place of Meduguri and northeast west that they are having a high temperature.
Hello? Malo? Okay. All right, let's come back to our guest, Dr. Mohammed. You've heard the questions. I notice you've been taking notes, so you can just respond.
Yeah, thank you very much. Let me thank all the callers for your keen interest and your enthusiasm to know more about this. And those who provided the comments, I think those are very good, particularly those who called on the public to cooperate. I think that is really commendable. Let me start with the first question from Andrew. He talked about local production of vaccines. That is something that is really desirable. In the past, when things were working very well, Nigeria tried to produce some of the vaccines, particularly yellow fever, in Lagos. This is in the 70s and 80s. Now, production of vaccine is so expensive that it cannot be sustained or it cannot be started by government. Most of the vaccines that now we said we want to procure, you know, they have several billions of dollars invested into the research and development process. And it is something that, you know, usually is left to the private sector. So it's the companies, the pharmaceutical companies, that usually take this R&D, because if you want your vaccine to be accepted globally, you're not only doing it in one particular place, you have to take it to different study centers for them to be done. So for example, if you take the AstraZeneca vaccine, it was the research was carried out in multiple countries, not only in the UK, in multiple countries, and they had data from that. So it is something that is really desirable, and it is something that I believe is in the development plan of the Federal Ministry of Health, and is something that, you know, with further development, that is where we hope to achieve. We are having a critical mass of scientists in the country, and we're even having some of them in diaspora who have been involved in this activity. So it's really a project that is desirable and that we hope to achieve one of these days. Then Adaura asked about her concern is about the NIN registration. Now, let me say that without being very specific. Anywhere where you have gathering of people that violates the protocol is something that we frown at. It's something that endangers the life of the people who attend and endangers the life of even the people who are providing the service. Particularly if
people are not even wearing the masks and they are not complying to hand sanitization and also the physical distancing. So we urge such conveners, be it banks, the telecommunication offices, or wherever this thing is going on, to ensure that they do it within the protocol, that people abide by social distancing, and that people who do not wear masks are not even allowed to get into the premises. That is the way to protect everyone.
And Fidel Oyinike, I talked about cold chain store and massive sensitization.
So there is a very serious move now that we are making before the vaccines arrive the country, which is to look at the state of preparedness and to boost our readiness to accept these vaccines. One of which is looking at the cold chain facility in the country, where these vaccines are going to be stored, how they are going to be moved, and when they reach the LGAs, where they are going to be stored also, and how they are going to be used. So all this effort is currently being going on. We have several technical working groups that are working day and night to ensure that we have a very solid plan, and whatever that we don't have on ground is identified and also procured before that time. You also talked about engagement of community through LGA. That is the way to go, to have grassroots enlightenment, awareness, sensitization, and ensure that people actually understand and know how to protect themselves, be it by using the non-pharmaceutical intervention or getting the vaccine when it becomes available.
I think we should take the last one, Adiko Malam. They talked about if there's a need for test before vaccination, and also cold chain facility for storage of the vaccine.
Yes, so I have just talked about the cold storage, okay, and we are really evaluating it and expanding. In terms of the vaccine, certainly, there are about 6 candidate vaccines for now. And each one may have its own specific contraindication to use. And certainly that will be used. Whichever vaccine we have, be it 1 or 2, we will certainly follow the protocol and ensure that only people who are eligible get the vaccine. Now, in terms of equity, I think one person talked about the equity of providing the vaccine. Now, the general rule of thumb that is being used globally now is to say that, health workers are the ones that are most at risk. When people are sick, the first place they go to is the hospital. And therefore, people with COVID-19 also do the same thing. And health workers, when they are not protected, they are the first people to get infected. And it's even a double jeopardy, because if health workers become infected, it means more people will get infected without having to get treatment, because people who will take care of them are also infected. So that's why healthcare workers, the first line, we are making every priority to make sure that the frontline health workers, people working in health facilities, people working at the airports or other points of entry, people who are involved in the COVID-19 rapid response, who are going around to search for people who have symptoms or contact tracing, are the first set of people that we will ensure that they get the vaccines.
Okay, let's go to the social media. We have quite a number of messages that came in through our WhatsApp portal. Yahya Wada says, good morning. Let me start by appreciating the effort of those handling the coordination of ensuring that all the set out measures are properly abided by. We shall overcome by God's grace. Thank you so much for that prayer. Mustafa here in Abuja says, good morning. I commend the PTF and COVID-19 on a job well done so far, especially keeping Nigerians updated on a daily basis in all that surrounds COVID-19 news. Some schools in Abuja, both private and government schools, have yet to adhere to the COVID-19 protocols. Is there a sanction, fine or penalty for this category of offense when Nigeria get the vaccine? The problem is the vaccines must be stored at -70 Celsius. What is beyond the capacity of standard freezers? How do we explain to store and distribute it? I think you answered that earlier already, both on except for that of fines for schools that are airing. Maybe we'll get.
Yes, so certainly,
Okay.
when we have.
You can quickly respond to that.
Yes,
then we'll take
so
from-
certainly, we are going to have a task force that is going to check. Every state is going to do that. Not only schools, people who are not compliant will certainly be penalized. They will be arrested and fined. Schools that don't comply will be closed and they will be fined as well.
Okay. Yes, that even takes us to the next contribution. That is similar to what Jonathan Femiduro from Port Harcourt. He says COVID-19 marshals should be set up in every ward to sensitize the people at the grassroots in their own local languages for them to know and believe that the disease is real, contrary to the opinion of many that it does not exist. The NOA has a lot to do in this regard. Then Felicia Ekaite from Uyo says, "Good morning, sirs, sir, the studio. I candidly share the view of the radio senator. If anyone does not want a stranger's food, she'll refuse it and provide for him or herself. In this context, everyone will air their views and yet no solution. And we keep talking. Well, what can we do? We keep talking and say our mind." Charles Ubege, Abuja, "To every policy of government, there are those for the policy and those against. My question is, what is the federal government doing to convince citizens to accept the vaccine?" So I think you can start from the last one and any other one that might need a response. I think most of them have already been addressed.
Yeah, absolutely.
Last one talked about.
So just to make a general comment, I must say that the federal government, Mr. President actually, has done a great move, or Mr. President has actually done the right thing in the first place by constituting the Presidential Task Force, which he used a whole government approach. This is very rare, where you have about 9 ministers, about 4 federal agencies, all working together to help address the pandemic. Mr. President did not look at it as just a health problem. He looked at it as a national problem and therefore required a whole of government approach. So the person that what government is doing, I think this blessing by Mr. President and his curious monitoring of what is going on. Every week, Mr. President gets a briefing from the PTF on what is going on. Okay. Secondly, let me also appreciate the leadership of the National Assembly, because they did something that is extraordinary. In the beginning, I remember the leadership of the National Assembly, even before COVID came into Nigeria, was the one that started the sensitization and preparing the government agencies for what is to come. They went on assessment of the airports, of the seaports, just to ensure that cases were not imported into the country. Okay. They also did the extraordinary work of making an appropriation, because the PTF did not have a budget, but the National Assembly quickly went and made funds available in the 2020 budget. And the same thing in 2021, to make sure that all the relevant agencies, health, NCDC, external affairs, all the other ministries have relevant line budget items that they can use to fight COVID-19. So with this, I think the government is really putting everything that it has to make sure that we combat this COVID-19.
Okay, let's quickly talk about recent developments in a state like Lagos. Lagos recently said that every case of malaria should be treated as suspected COVID-19. What will you want to say about this?
Well, actually, that is the right thing to do, and it's not only Lagos. If you look at the NCDC case definition, okay, what we call a case definition is who do you suspect has COVID-19. So anybody that has fever, that's why we do temperature checks. Anybody that has fever is a suspected case, so we have to test you for that. Anybody that has cough, sneezing, difficulty in breathing, they are all suspected cases. And this is what we put inside the case definition. In addition to that, we also added people who are asymptomatic, that is, people who come into contact with people who have these symptoms, or someone who was diagnosed to have COVID-19 and you came into contact with him.
you too become a suspected case, and we need to have you tested. So what Lagos did is not out of place. It is the right thing, and actually that is what everyone else is already doing. Maybe they didn't say it in that terms.
Okay. So while now let's look at safety protocols that have been adopted to ensure that those who come to their demise or who we've lost in the course of the infection, how do they handle such to avoid it from constituting dangers to others, danger of infection to others?
Okay, handling of dead bodies?
Yes, those who...
Well, we have standard protocols, and the good thing is we have done training for the hospital staff, all people working in health facilities, particularly the mortuary staff, on how to handle cases of COVID-19. We've also done training for the religious leaders, particularly the Muslim group, that requires immediate burial.
Okay.
We have done extensive training for them on how to handle that. This has been done centrally in Abuja, and we have urged all the state teams also to do the same for their members. So it is something that is common knowledge, I will say, in the places where it is done officially. However, let me just reiterate that even though we say dead bodies do not transmit COVID,
Okay.
but we still have to take the extra caution. Nobody should use their bare hands to wash bodies of people who are infected with COVID, and you must be fully protected with gloves and the suit and face mask and even goggles and face shield before you do that, so that you don't have any splash. And all of these disposable materials that you use to protect yourself must be properly incinerated and carted away. So you must also, as a matter of urgency, as soon as you do that, you must take a thorough bath and clean yourself, before you change into your normal clothing. Thank you.
So, just very quickly, in less than a minute, what is the level of partnership with state governments? Is there a synergy now? Because sometimes you see state governments come up with their own policies to check the spread, and it might not be the same with the federal government.
So, as a matter of routine, the PTF has made it as a routine, that we consult with the governors. Even yesterday, there was a meeting of all the state governors, and even today, the PTF is also going to join the meeting of the state governors. We have a subcommittee of the Governors Forum that is dedicated to COVID-19 and is headed by the Imo State Governor. So we are working hand in hand with the governors. The governors have a very critical role to play. Number one, they are the leaders of the state. They are the ones to make funding available for the response to take effect. And you're not a governor by chance. You are selected by the majority of the people, and therefore you are what we call a gatekeeper. So governors must be very critical, and the statements matters to the people. So lately, we have heard of some people who made some quite undignified comments about COVID-19. Now, that is very serious and is regrettable, and I don't think anybody in leadership position, even a local government chairman, should not go about inciting people, making false claims or making false statements. Now, that is certainly not a good leadership.
All right.
And that is something that we really frown at, and we discourage, and we are taking every measures behind the scene to make sure that this issue is addressed properly.
So, final words on the program now, because we're running fast out of time. What should be expected in coming days, weeks, months, and a year, and what does government expect of the citizenry in checking the spread of COVID-19?
Absolutely. Now we are tightening our belts. We are monitoring the situation in the country very closely, and we are taking very serious measures which are going to be made to the public very soon. The numbers have continued to rise. All the conditions that we mentioned before the end of last year have actually escalated. And therefore, now is the time to take the serious actions. We are taking these actions not because we want to, but because they are necessary. And while doing that, we will also make sure that it has very minimal negative impact on the economy and livelihood of the people. So I call on Nigerians to kindly understand where we are coming from, to have good knowledge about the program, and to also understand that government is doing its best to make sure that we take good balance, between fighting the disease and also protecting the livelihood of Nigerians.
All right. Thank you so much, Dr. Mukhtar Mohammed. Thank you so much for your time. We hope you come call in next time we send you an invitation.
Thank you very much. I really enjoyed participation, and thank you for giving me this opportunity. Thank you, Nigerians.
All right. We've been speaking with the Incident Manager of the Presidential Task Force, PTF, on COVID-19, Dr. Mukhtar Mohammed. At this time, we wish to thank the production crew, our news producer, Conrad Labe and Hassan Hussein, online editor, Timothy Bamidele, ICT Israel Chiokaha, our studio manager, Prince Afonia Ugweze. Our engineer was Hassan Usman, our photographer, Grace Omale. Cameras were handled by Fuluwa Oloyede and Chinedu Mmegwa. Facilitator was Oluwada Minola Oni. Our producer was Oledo Mbiwe, and the executive producer, Sani Suleiman. Special appreciation to the Director General of the Federal Radio Corporation of Nigeria, FRCN, Dr. Mansour Liman. Don't forget to join us next week for another edition of Have Your Say. My name is Olayemi Daniel saying, stay safe. COVID-19 is real, think right,